Hello, can you introduce yourself?
Yes, my name's Karen Howard. I'm a reception supervisor at Furlong Medical Centre.
And can you tell us how patients have been asked here to give feedback through the Friends and Family test?
Quite simply really, we just had the forms on the reception desk, and as people were booking in for their appointments with the nurse or the doctor, we asked them if they wouldn't mind filling in one of the forms explaining what it was for, and just to pop it in the box on the way out. And it was all quite anonymous, and most people obliged.
Oh, great. And how do you think the Friends and Family test has had an impact on your GP practice?
Well, it was taken seriously because our practice manager wanted a monthly report, and then discussed it in the Wednesday practice meeting with the GPs with a realistic approach, really. If they could change something, then they would. But not all things could be changed, but it was taken quite seriously.
So as a member of staff, do you think it's good to get feedback through from patients?
Yes, because you can become quite complacent in your roles, and it's a wake-up call if you see some negative comments, as well as it's very good for your morale if you see the positive comments as well.
Do you think that overall it's a good way of getting feedback from patients?
Yes, I do. I think patients tend to want to please the person who's asked the question, so they'll say yes to a lot of things. But if you're asking them whether they would recommend it to their family and friends, then I think they would give you a more realistic answer.
And do you think overall that the Friends and Family test is a good way for GP practices to get feedback from patients?
Yes, it is, because you're getting people as they're actually using the service that day. Some people don't respond to letters, and they're going by memory of perhaps a year or two ago when they were last in the surgery, so it's best to do it this way.